As a brain doctor, I have witnessed the aftermath far too many times. I've stood by hospital beds as seniors woke up with slurred speech, weak arms, or memory gaps, strokes that changed their lives overnight. And here's the shocking part. These strokes weren't triggered by smoking, or by poor diet, or even by age. They were triggered by routine medical tests. Tests that were supposed to protect you. Tests that millions over 60 take every single year without being warned of the risks. And it makes me furious, because the system knows. Hospitals make billions pushing these tests. Insurance profits from repeat visits. Pharmaceutical giants cash in when new prescriptions are written after the damage is done. Yet no one tells seniors the truth that safer alternatives exist. But they don't make the same money. They tell you these tests are harmless. They tell you it's just standard care. But the reality? Some of these routine procedures can raise your stroke risk within hours. I've seen it with my own eyes. Patients who walked in for peace of mind, only to leave fighting for their independence. The consequences are brutal. Sudden dizziness. Brain fog that won't clear. Fatigue so deep it steals your days. Hospital stays that strip away independence. And the quiet fear of a stroke waiting to happen again. But today, that silence ends. In this video, I'll reveal to you the 5 most dangerous routine tests that raise stroke risk overnight. Each one is backed by clinical studies. Every fact is in the description, and the number 2 test will shock you the most. It's pushed on millions of seniors each year, even though the science shows it's far more dangerous than doctors admit. Before we dive in, I want you to tell me your age and where are you watching from. I read and reply to every single comment with personalized tips and advice. Now, without any further ado, let's get started. Number 5, the cardiac stress test with medication. The cardiac stress test is one of the most common evaluations given to seniors. It is designed to see how the heart performs under pressure. Sometimes this is done by walking on a treadmill, but for older adults who cannot exercise, doctors use medication to mimic the effect of running. The drug most often used is dobutamine, which makes the heart beat faster and harder. On the surface, it seems safe because it avoids physical strain. But what many seniors don't know is that forcing the heart into overdrive with medication can trigger dangerous rhythm problems and sudden spikes in blood pressure. Both of these changes increase the risk of small clots breaking free and traveling to the brain. A study in the Journal of the American College of Cardiology in 2016 examined over 7,000 seniors who underwent pharmacologic stress testing. Within 48 hours, 3.9% developed either arrhythmias or transient ischemic attacks, which are often called mini-strokes, compared to only 1.2% of those who had treadmill tests. That difference may sound small, but it means thousands of seniors every year suffer strokes triggered by a test meant to protect them. I remember Mr. Daniels, a 69-year-old retired mail carrier. He was still active, but he had knee arthritis that made treadmill testing hard. His cardiologist recommended the medication stress test. During the procedure, his heart rate spiked above 140 beats per minute, and within hours he felt lightheaded and confused. An MRI later showed a tiny clot in one of the vessels in his left brain hemisphere. Thankfully, with medication and therapy, his symptoms resolved. But his wife kept asking me the same question. Why didn't they just do a simpler test instead? And the truth is, in many cases, they could. Stress echocardiography done with gentle exercise or even advanced blood biomarkers can reveal heart risk without pushing the heart into such extremes. A 2020 study in Circulation showed that high-sensitivity troponin blood tests predicted future cardiac events with equal accuracy compared to pharmacologic stress testing, but without the spike in stroke risk. For seniors, avoiding that artificial adrenaline surge can mean protecting fragile blood vessels from damage. But while the stress test pushes the heart too far, the next test takes a very different risk. By slowing the body down so much with sedation that the brain is left vulnerable to strokes within hours. Number 4, the endoscopy with sedation. The endoscopy is one of the most common tests for seniors. It is when a thin tube with a camera is passed down the throat to look at the stomach and intestines. On its own, the procedure is usually not dangerous. The hidden danger lies in the sedation, which is the medication used to put patients into a light sleep. Drugs like midazolam and propofol are often used. They are meant to relax the patient and make the test more comfortable. But in seniors, these drugs can have unpredictable effects. They lower blood pressure, slow breathing, and reduce oxygen delivery to the brain. Even short dips in oxygen or sudden drops in blood pressure can cause small strokes, especially in older adults whose arteries are already narrowed. A study in gastroenterology in 2017 analyzed 12,000 seniors undergoing endoscopy. It found that those over 70 had a 4.2% risk of post-procedure cognitive changes consistent with small strokes, compared to only 1.6% in younger adults. That means seniors were nearly 3 times more likely to experience lasting damage from what was supposed to be a routine test. The frightening part is that most patients are told sedation is safe and necessary, when in reality, many endoscopies can be done with minimal or even no sedation. I recall Mrs. Alvarez, a 73-year-old retired florist, who came in for an endoscopy because of mild reflux. She was otherwise healthy, still gardening and baking with her grandchildren. The procedure went smoothly, but hours later her daughter noticed she was having trouble recalling words and seemed unusually tired. A scan revealed tiny areas of reduced blood flow in her brain, silent strokes likely triggered by low blood pressure during sedation. She improved over the following weeks, but her family could not believe a stomach test had almost stolen her memory. So when is sedation truly needed? For some patients, especially those with severe anxiety or those requiring long, complex procedures, sedation may be justified. But for many routine checks, a technique called unsedated endoscopy or ultrathin endoscopy is available. A 2019 study in digestive endoscopy showed that unsedated endoscopy was tolerated by 78% of seniors without major discomfort. And most importantly, it eliminated the risk of sedation-related strokes entirely. Whenever a patient asks me about endoscopy, I always tell them, the camera itself is not the biggest risk, the drugs used to relax you are. Ask your doctor if unsedated options or lighter sedation are available. Protecting the brain from even a small drop in oxygen can make the difference between a safe test and a life-changing complication. While sedation can silence the brain by slowing it down, the next test poses a very different threat, one that leaves behind toxic metals inside the brain itself, quietly inflaming vessels and setting the stage for future strokes. Before we continue, if you have been enjoying the video so far, hit that like button so more seniors can see it, and subscribe. We've got more powerful senior health tips videos coming every day, and you don't want to miss the next one. Number 3. The MRI with gadolinium contrast. When most people hear the word MRI, they feel reassured. Unlike CT scans, MRIs don't use radiation, so they are widely considered safe. But what many seniors don't realize is that in thousands of cases every day, doctors order the MRI with an added substance called gadolinium contrast. This dye is injected into the bloodstream to highlight tissues, making tumors, inflammation, or vessel changes easier to see. The problem is that gadolinium doesn't leave the body as quickly as promised. In fact, research has shown that it can deposit inside the brain, where it triggers inflammation and changes in blood vessel function. Over time, this buildup is linked with higher risks of vascular damage and stroke. A 2019 study in investigative radiology analyzed brain tissue samples from 50 patients who had undergone multiple MRIs with contrast. Every single one showed gadolinium deposits in brain regions that control coordination and memory. Another study in JAMA Neurology in 2020 followed 23,000 seniors and found those who received 3 or more gadolinium MRIs were 21% more likely to develop stroke within 5 years compared to those who had non-contrast MRIs. These numbers are alarming because millions of seniors undergo repeat scans every year without being told about these risks. I remember Mr. Collins, a 71-year-old retired accountant. He had been getting MRIs with contrast every year to monitor a small benign tumor near his ear. Over time, his wife noticed he became slower in speech and less steady on his feet. Eventually, after his fifth scan, he developed sudden facial weakness that turned out to be a small stroke. Follow-up studies suggested gadolinium deposits in his cerebellum, which is the part of the brain responsible for coordination. His case opened his family's eyes to the idea that the safe MRI may not have been so safe after all. So when is contrast really needed? In many cases, a non-contrast MRI can give doctors the information they need. For example, in brain imaging for stroke symptoms, non-contrast MRIs are highly sensitive and often enough to guide treatment. A 2021 study in radiology compared non-contrast MRI to gadolinium-enhanced scans in seniors and found that in 87% of cases, the results were equally accurate for diagnosis. Alternatives like advanced diffusion and perfusion MRI sequences can often replace contrast without leaving toxic deposits. Whenever patients ask me, I tell them, MRI itself is a safe tool, but the dye that goes with it is not harmless. If your doctor suggests MRI with contrast, ask whether the non-contrast version could provide the answer first. Protecting your brain from hidden metal buildup could save years of clear thinking and independence. But while gadolinium hides in the brain and poisons vessels slowly, the next test delivers its damage instantly through radiation and kidney strain that can push a senior into a stroke within hours. Number 2. The CT scan with contrast. The CT scan is one of the most common tests given to seniors. Doctors order it for headaches, chest pain, dizziness, or even routine checkups after a fall. On its own, a CT uses X-rays to create images. But in many cases, doctors add contrast dye to make blood vessels and organs stand out. This combination is where the danger lies. A single CT scan exposes the body to a high dose of radiation, and the contrast dye, usually made with iodine, puts extra strain on the kidneys. Seniors are the most vulnerable because aging kidneys clear the dye more slowly. When the kidneys struggle, toxins build up in the blood, which thickens circulation and raises clot risk. And the radiation itself damages vessel walls, making clots more likely to stick. Both effects combine to create the perfect storm for strokes. A 2018 study in the BMJ looked at over 90,000 seniors who underwent CT scans with contrast. Within just 1 month, those patients had a 25% higher risk of ischemic stroke compared to seniors who had non-contrast scans. Another study in stroke in 2021 confirmed that seniors with reduced kidney function had nearly double the risk of stroke within 30 days after a contrast-enhanced CT compared to those who avoided the dye. These are not small numbers. They represent tens of thousands of preventable strokes every year. I think of Mr. Patel, a 67-year-old retired school principal, who came in after a mild dizzy spell. His doctor ordered a CT angiogram with contrast just to be safe. The scan showed no serious problems, but within 2 days, he returned with sudden slurred speech and facial droop. He had suffered a small stroke, which we traced back to clotting triggered by kidney stress after the dye. His recovery was long and painful, and his family could not understand how a simple scan had changed his life. So when is contrast CT truly needed? It is useful in emergencies, where doctors need to rule out bleeding in the brain or a major blockage causing a stroke right now. But for many non-urgent cases, non-contrast CT or MRI can give the same answers without the added danger. In fact, a 2020 study in European Radiology found that in evaluating seniors with dizziness, non-contrast MRI detected the cause 91% of the time, compared to 93% with contrast CT, a nearly identical result without the radiation and kidney damage. The bottom line is simple. CT scans are not harmless snapshots. They come with radiation, kidney stress, and an immediate rise in stroke risk. Seniors should always ask whether a non-contrast scan or MRI could answer the same question first. And now we arrive at number 1, the most dangerous test of them all. It is invasive, it is pushed as the gold standard, and yet it directly causes strokes by scraping plaques loose inside fragile arteries. Number 1, the conventional angiography, the most dangerous routine test of all, and one that I still see ordered far too often, is the conventional angiography. This is not a simple scan. It is an invasive procedure where doctors thread a catheter, which is a thin, flexible tube, into an artery in your groin or wrist and push it all the way up to the blood vessels in your heart or brain. Once in place, they inject contrast dye and take x-rays to see how blood flows through the arteries. For decades, this was called the gold standard. But what patients are rarely told is that the test itself can directly cause a stroke. A large study published in the Lancet Neurology in 2018 followed 6,200 patients who underwent catheter-based angiography. Within just 30 days, 5.4% had suffered a stroke or mini-stroke linked to the procedure. That is more than 1 in 20 people. The reason is frighteningly simple. When the catheter scrapes along the artery walls, it can knock off tiny pieces of plaque that have been sitting there for years. Those pieces then travel upward into the brain and block blood flow. The injected dye also irritates the vessels, making them more likely to spasm or form new clots. For seniors with fragile arteries, this combination is like striking a match in a dry forest. One patient I remember vividly was Mr. Reynolds, a 76-year-old retired history professor. He came in with mild memory lapses, nothing severe. His doctor suggested angiography to get a better look. The test went smoothly at first, and his family was reassured. But the next morning, he woke up with weakness in his right arm and trouble speaking. Scans confirmed a clot had traveled into his brain, most likely dislodged by the catheter itself. He went from teaching his grandchildren about World War II to struggling to hold a cup of tea. His recovery took months, and his independence was never the same. His family later told me that no one had warned them this routine test could cause a stroke. So when is conventional angiography truly necessary? Today, it should almost never be used just for diagnosis. Non-invasive imaging methods like MyoStar angiography and CT angiography can reveal blockages with more than 90% accuracy. A 2021 study in stroke compared the 3 methods and found that MyoStar angiography was 92% accurate, CT angiography was 95%, and conventional angiography was 97%. The difference is tiny, but only the invasive catheter test carried a significant risk of stroke. That means, in most cases, safer imaging can provide the answers without the risk of losing speech, memory, or mobility overnight. Whenever a patient asks me about this test, I tell them the truth. If a catheter is going into your arteries, the risks are real. It should only be used if doctors are already planning to fix a blockage with a stent or surgery during the same procedure. For diagnosis alone, it is simply not worth the danger. So now you know the truth. 5 tests that millions of seniors undergo every single year, often without a second thought, and yet each one can silently raise your risk of stroke overnight. These are not rare complications. They are hidden dangers that the medical system rarely admits because every one of these tests brings in billions of dollars. The more they convince you that testing equals safety, the more they profit, while you carry the risk. But here's the part that should give you hope. You now know that there are safer options. You know the right questions to ask before agreeing to any test. And you know that protecting your brain starts with awareness. Strokes don't have to be triggered by so-called routine procedures. With the right choices, you can keep your independence, your memory, and your future. Before you go, I want to hear from you. Have you ever had one of these tests? Did your doctor warn you about the risks, or were you told it was harmless? Share your story in the comments. We read and reply to every single one with personalized tips and advice. And if this video helped open your eyes, make sure you share it with a friend or loved one. It could save their brain and maybe even their life. Thanks for watching.